Hello, my name is Nina Shah at the University of California, San Francisco, and I'd like to talk to you about data that was presented from my work at MD Anderson Cancer Center on a phase 2 study of cord blood-derived natural killer cells for multiple myeloma. Natural killer cells are a known killer cell for multiple malignancies, but have been shown in preclinical work to be able to kill myeloma. We were able to develop an NK cell source from umbilical cord blood by culturing these cells for 2 weeks. We performed a phase 2 study after previously proving that these NK cells were safe to give in humans with multiple myeloma. In this study, we had an autologous stem cell platform, so patients received melphalan 200 milligrams per meter squared, as you would normally receive in a transplant, but 2 days later, they received these cord blood natural killer cells. 5 days later, they received their stem cell transplant graft, as you would normally do in a transplant. We also gave a very low dose of lenalidomide during this time because we thought from preclinical data that the NK cells would be stimulated with the lenalidomide. The patients that were on this trial tended to be a higher risk group. At least 75% of them had one of the following adverse features, for example, ISS3 disease or high-risk cytogenetics or FISH, or a history of progression or relapse. We followed these patients out for a little over 2 years, and so far we've been able to see at day 100, we had at least 79% of patients achieve VGPR or better, and 61% of patients had MRD negativity at day 100. So far, there have not been serious safety concerns of graft versus host disease or CRS, cytokine release syndrome, or neurotoxicity. We were also able to detect some of these cord blood NK cells in the patients, suggesting that we are able to at least find them and hopefully in the future interrogate them to know if they're active or not. In total, so far, after about 2 years of follow-up, 3 patients have died, so it's about 90% overall survival right now. We are estimating the 3-year progression-free survival to be something like 52%, but we don't know for sure yet. Again, in this high-risk group of patients, this is encouraging. A lot of people ask, well, what did the NK cells do? And we don't know so far. We don't know whether they added much to the chemo. We think they did because of the data we're seeing, but the only way to know is to follow these people out longer and also to complete our correlative studies, which will help us to understand how the NK cells were acting. In the future, I think that we need to combine cellular therapy with the tools we already have. For example, for NK cells, a great combination would be something like an antibody therapy like elotuzumab. And potentially, we could use our knowledge of T cells to engineer NK cells to hopefully last longer, and maybe, like CAR T cells, make CAR NK cells to be more specific towards the myeloma. Thank you very much.